Thank you for coming to watch this video about eczema school awareness sessions. This presentation was created by Emmy Hawthorne and I am Farhana Yasmin, the atopy nurse. What is eczema? Eczema is a chronic dry skin condition, also known as atopic dermatitis. Eczema is caused by a combination of genetic and environmental factors. Eczema is not contagious and is vital that everyone who comes into contact with the child who suffers with eczema understands that. There's no cure for eczema, but treatment can ease their symptoms. Be aware that inflammation is not always red and often poorly described and underestimated in darker skin tones. Eczema appears differently on different skin colours. Typical and common locations of eczema. So as you can see in these images, eczema typically appears on the cheek, around the groin areas, inside the arm, the crease of the arm, the crease of the leg joints in our hands, around our necks, especially in younger children, around the chin, when they have contact dermatitis as well. These are the areas to look out for eczema. The genetic defective skin barrier in atopic eczema. The skin is the largest organ in the body. It protects and regulates our temperature. It is important that we support children and encourage them to do their best, to do our best to protect and look after it. Like a brick wall, in eczema, the function is not working properly, as in compromised skin barrier, as you can see in the images. There is gaps in the brick that protects the skin. Inflammation is not always red and often poorly described and underestimated in darker skin tones. This image describes the itch-scratch cycle. Skin itching. It leads to scratching. Scratching then damages the skin, causing eczema to worsen. This leads to more itching, and itching leads to scratching. This, of course, can be distressing for a child at school. Antihistamines. No role for non-sedating antihistamines. Sedating antihistamines, such as Piriton, short-term, for restoring sleep only, but we also do not want the patient to become reliant on this to sleep. Complete emollient therapy is what will soothe and help break the cycle. Eczema is not just simply a common skin condition that causes discomfort. The child scratches the skin and this will likely bleed and become infected. Sleepless nights for the child and the whole family in turn leads to high absenteeism from playgroup or schools. The child is conscious of how the skin looks and can affect them in different ways, can have a profound impact on a person's mental health, causing intense emotions such as anxiety, stress, worry, anger, embarrassment, changes in emotional state including anxiety, stress and low self-esteem. This can lead to social isolation, embarrassment, shame and depression. Unfortunately for the child and young person, it's not just the discomfort. These symptoms are noticeable, which can make them very self-conscious. Some of the symptoms of eczema are dry, itchy, sore, red, blistered, crusted, cracked and scaly skin. The irritation that constantly is there, and extreme itchiness can cause sleep disruption or worse, keep a person awake all night. Those that are not directly affected by skin disease tend to trivialize them. Some even find them repellent. Their indifference or distaste is often exacerbated by the misplaced assumption that skin disease are contagious or that they are caused by poor hygiene. For example, people with eczema are often unable to wear certain types of clothing, makeup or other cosmetics. Often the rash appears predominantly on the face, causing embarrassment and for some extreme problems with self-image. The whole family can be affected in one way or another. Parents caring for children with eczema may feel distressed about their child's emotional health and their inability to help. Because of this, they may also experience feelings of guilt and depression. Siblings may also feel jealous or excluded. Parents may struggle with keeping up with the regimes. Schools can offer psychological support and notice when children are isolating themselves and allow them to apply treatment more frequently within school time. Triggers. It's best to avoid. Good ventilation can prevent child from overheating, sweating and then itching. Avoid cutting grass or freshly cut grass, soaps, shower gels, shampoo, bubble bath, washing powder, fabric softeners, scented products like perfume, chemicals such as paint, clay or glue. So grass, pollen, dust, animal hair. Clothing that are not soft, smooth and breathable should also be well rinsed after washing. New clothes always should be washed initially after purchase. And being too hot or too cold. Moisture on the skin like sweat dribble or wet, dirty nappies should be changed immediately. A runny nose. These are all the things that can further dry the skin out. Stress can make eczema worse and can make sufferers feel itchier. Chlorinated swimming pools may worsen some children's eczema. Apply moisturizers before swimming and shower afterwards, straight after the swimming is done, and apply moisturizer again. Washing hands when outside with pollen. Sitting on stools instead of sitting on the carpet. This will help prevent exacerbations. Irritant reactions to food is very common. Oral allergy syndrome. Certain foods can cause irritant dermatitis. For example, citrus fruit, tomato ketchup, strawberries, onions, peppers and chilies. This is not a food allergy. Babies and toddlers and young children are messy eaters. Usually, using an emollient as a barrier around the mouth prior to meal time and removing food residue with a damp cotton pad and emollient will help prevent these. Do not use wet wipes. Bathing and hair washing. This is advice that is normally given to parents. Once a day, it is considered optimal to remove build-up of organic debris. We have quite hard water in London, which can further dry out the skin. So where possible for this, bathing and not showering is considered better. To add bath oil to water to soften it. Please do not use Dermal 500 as a regular soap substitute, as this can be quite harsh for the skin of babies and young children with mild eczema. It has its place as an antiseptic, but is not gentle. The GP should not be giving you this on repeat, as it is for short-term use only and can further irritate the skin. After a bath, do pat dry, do not rub the skin, do not share any towels. Applying emollients. Gentle strokes following direction of hair will prevent clogging up the hair follicles with emollients, which can cause bacterial infection, can also trigger itchiness. Moisturizers come as gels, creams and ointments. Ointments are the most effective for very dry skin. Moisturizers can also be used as soap substitute to wash. Steroids. Steroids should be used on red or itchy areas of the skin only. They should be applied 15 to 20 minutes apart from moisturizers, giving time for it to be properly absorbed into the skin and to avoid diluting the corticosteroid and reducing its effectiveness. You will be provided with 2 topical steroid emollients, a milder one on thinner skin such as face, neck and then one for managing your whole body. There is a steroid ladder. It is important that the children are on the correct steroid. They can be stepped up during eczema exacerbations. Use steroids on active eczema only.
So after waiting 20 minutes for the topical steroids to get absorbed into the skin, with clean hands or gloves on, we want to apply our emollients thickly. Whether ointments, cream or lotions, we always do this in a downwards motion in the direction of hair growth, making sure it's visible on the skin and not over rubbing. There's no limit to how often we put on emollients. It can be from 2 to 8 times a day, depending on flare-ups. So with clean hands or gloves on, we just want to squeeze a fingertip unit of the topical steroid and spread thinly to affected areas. So this is where the skin may be inflamed, thick, red, itchy, or just where there's the more stubborn patches of eczema, and we just want to spread it across thinly, as you can see here. Socks are zinc oxide impregnated sterile stockings. They're used to soothe and protect the lower legs and arms. After applying emollients and treatments to the skin, the zip-zock bandaging can be applied over this by measuring and cutting to size. So cut to the size of legs or arms that you are treating, making sure that all the affected areas are covered. So from the base of the toes to the knees and from the wrist to the shoulder. All folds should be smoothed out where possible, although I know this can be quite tricky with toddlers and active babies. And to protect clothes from the zinc in the zip-zock, a suitable outer bandage should be worn. So apply this loosely so it's not too tight and the patient can still move around freely without discomfort. Please remember that zip-zock is single use only and should be changed on a daily basis and reapplied once the skin has been cleansed and remoisturized. Do not keep the zip-zock on for longer than 24 to 48 hours at the most, as emollients can dry out and the skin will get very dry and sweaty. It's also important that if you start to notice that the skin becomes infected or starts to ooze, that you stop the bandaging treatment immediately and contact your GP or healthcare professional for a review. Zip-zocks are zinc oxide impregnated sterile stockings. They're used to soothe and protect the lower legs and arms.
Flare-ups and when to seek help. It is important to remember that there is not a cure for eczema, and therefore flare-ups are expected. If you have any concerns about the child's eczema management of their skin, or if their learning attendance is affected, please ask parents to speak and be referred to eczema specialist service. If requiring any teaching support at school, please contact the eczema specialist service. No improvements in managing symptoms despite doing all the right things. If eczema is often infected, weeping, yellow, crust and painful. If eczema doesn't go away, and with the use of steroids every day for 2 weeks, if steroid creams are needed most days of the week, and bathing daily and moisturizing frequently. If the child is not sleeping or missing school, then it's important to refer to the eczema specialist service. Infection. Signs of infection include sore and broken skin, red and swollen, fluid-filled blisters, yellow discharge, crust and feeling hot and shivery. If the eczema is infected, please inform the parents about cold sores and chickenpox at school. Antibiotics may be suggested if there are signs of skin infections. Keep nails short. The cold sore virus can infect eczema, so try to avoid direct contact with cold sores. If the child comes into contact with anyone with chickenpox anywhere in the school, to inform the parents, carers as soon as possible. Sun cream. The sun cream needs to have SPF 45 plus. Of course, no sunscreen provides 100% protection, but the best protection is shade. So wearing protective clothing and hat and sunglasses, if possible, avoiding the sun when it is the most hottest in the day. Please do not use other children's or ones that have not been provided by the parents, as eczema children can have sensitive skin. It is always good to apply sun cream to a small area of skin free from eczema first to test tolerance. Dermatology approved ones include Sunsense, La Roche-Posay, Uvistat or Aveeno. To conclude, what are the 4 main principles to control and manage eczema? Number 1, avoiding trigger factors. Number 2, frequent use of emollients, moisturizers every day, at least twice a day, all over the body, 4 to 6 times during flare-ups. Number 3, use a topical steroid, so steroid creams or ointments, for flared areas to treat the rough patches of skin when they are present. Number 4, using soap substitutes to bathe and wash hands, and avoiding all soaps, shower gels and bubble bath with fragrances. Support at school and nursery. Care plans available in school. We recommend having treatment at school and nursery for adjustments to be made, soap substitutes in places to wash hands when using the bathroom, emollients to apply throughout the day as and when required, emollient sprays for swimming, etc. Travel size available to apply independently as and when. Ensure that the child does not come into contact with anyone with herpes simplex. If there is a case of chickenpox anywhere in the school, inform the parents and carers as soon as possible. So this is what your eczema care plan in school would look like. This is great for parents and caregivers, patients and also schools and support staff too. So please do check them out.